Hi, my name is Dr. William O'Connor. I'm an MD and in private practice in Vacaville, California. I've spent the majority of my medical career studying back pain. I wrote a book on it called Making Your Bad Back Better, produced a website, which again is called Making Your Bad Back Better, and it teaches people how to become, in essence, their own chiropractor. It is based on the understanding that the overwhelming majority of back pain is caused by pieces of disc material that should be centralized, moving posteriorly and being displaced. And when it's displaced, it causes pain and an interruption of the normal range of motion. My website discusses how that can be managed by a self-manipulation technique. But what I want to discuss right now is how it can relieve the bending problems that most teenage girls have from scoliosis. Scoliosis, if you look and review the medical literature, doesn't have much to do except offer surgery. This is a non-surgical technique that basically challenges the understanding of how scoliosis is caused. And if it's caused by a piece of disc material that is displaced, it can be fixed with the O'Connor technique. It can be improved by the O'Connor technique. I know that because I've done it. I have here radiologic evidence of showing a 15.2% total improvement in the degree of scoliosis in only 1 month. It was very impressive. I have a video clip I want you to see. You'll see in this video the clip of the mother and the daughter. And I'm going to tell you how this scoliosis condition originates and how it can be managed. Most scoliosis is called idiopathic scoliosis. The majority of scoliosis problems is termed idiopathic. That basically means we don't know what causes it. Well, I don't use that term idiopathic when I'm referring to teenage girls who have scoliosis, because I've discovered the reason why it happens. It happens due to displaced disc material, and therefore it is a compensatory scoliosis. What happens is when a child falls, they commit a weight-bearing flexion. They fall backwards, most playing soccer or doing some activity. And what that does is it puts a weight-bearing flexion force on the lower part of the spine and pushes their discs out and displaces the disc material. What that does is it creates a wedge-like effect in the side and back of the intervertebral disc, which tilts that disc unit quite substantially. So if you have a normal spine in its normal alignment, and then down here you get something that puts a wedge that bends this part of the spine this direction, the spine would be tilted very far to one side. What happens is that you can't walk around bent to the side. And so what the body does is it brings the center of gravity back over by bending to the opposite side. And you create a scoliosis. And what I'm saying is happening is if, let's say, a disc goes out to the right, you fall down on your butt, and you're bent a little bit to the right, the disc goes out to the right, it creates a wedge-like that lists the whole spine to the left. Well, as a result of that listing to the left, the teenager or even the preteen bends their upper body to compensate for that, to get their center of gravity over that spine, over their hips, so that they can walk. Well, what they do is they end up walking like this, and the spine creates a scoliosis. That can be relieved and solved. The problem can be solved by putting the disc in. That's what my website teaches a person how to do. By putting the disc back in, into the center, the original source of that tilting is alleviated and the spine can re-straighten. If it isn't, they continue to walk like this, and once they go through their full growth, which is like age 25, that can become permanent. If it's caught early and it's recognized by putting the disc in, and I've done it on numbers of teenagers and preteens, and I've relieved their scoliosis. I'd like you to look at that video. I'd like you to listen to the mother. Those are real people. And I've I've developed a technique that can take people out of pain, because most of them have pain in their low backs, restore their range of motion, and over time, straighten their scoliosis. That's quite an amazing accomplishment. And by rights, I should have a line of people around the block waiting to have me cure their teenagers or help their teenagers or re-straighten their teenagers. But I'm not a marketer. I'm a doctor. If you know of anyone who has a teenage young girl with scoliosis, go to my website, Making Your Bad Back Better, or make an appointment with me in Vacaville, California, Dr. William O'Connor. Let me examine you, and if I can identify that this is caused by a piece of disc material that has been displaced, I can put that piece of disc material back in. Usually about 90% of the time I'm successful. And those girls don't have to look forward to a lifetime of pain and deformity. Thank you.